The recording will come to you in a package, which we aim to send to you a facilitator package email, probably either Friday, possibly, or Monday. And it'll cover everything. It'll have in it everything that we need. So this session is next Friday, 3 to 5. It's in person. It's on the Bannatyne campus. So one thing that we are asking for our facilitators to do is to arrive in the room before 3 o'clock. So before the students arrive, as well, we have some patients coming to share their stories. So if you arrive around 2:45, if that's possible, if not, and you need us to set up the room, that'd be okay as well. But in the room, if you arrive before 2:45, you will be able to set up the students in the team. So we have created, those paper tents where you just put the tent number, you put the team 1, team 2, and just put those scattered around the room, close to the front of the room, but with enough space between teams that they can hear each other in their own team and not be over another team override them. So we ask this because there are no microphones. The patient who's going to share their stories has asked us if there are microphones, but we pretty much encourage them that we will have the students sitting close to the front of the room. And it's sort of to simulate the idea that we are groups of teams of learners, and a patients come to share their story, and then for us to learn with, from, and about them. So also, when you put the team tent, which will be in the package for you, there'll be a PDF of a QR code for attendance and a PDF or a paper copy of the QR code for the evaluation for the students to provide us with their feedback. So those will be items that you will have in the package, which you'll put beside each team tent. And then there's another little item there, just the students' note-taking template that we've created for them, which will make more sense as we get into the session. So the patient and family advisor, they are coming from Shared Health, patient family advisor engagement office. So people who have worked with Shared Health to prepare their stories, share their stories with many health professionals for the purpose of quality insurance and assurance and patient safety. As well, there's a patient engagement office with the Center for Healthcare Improvement here on our campus, and they also have some patients that are coming to share with us. So the people that are sharing with us are either the patient themselves or a family member who is sharing the story. All of them have been vetted, and all of them have signed agreements with Shared Health and the Center for Healthcare Improvement to do this work. So we've checked in on all of that from a privacy and confidentiality perspective. So they'll be arriving around 2:55, and we'll just welcome them in and get them situated at the front of the room, or I guess, at the front of the room.
Yeah, and at the front of the room, we talked with them yesterday, and I think that depending on some may have accessibility, like maybe in a wheelchair situated at the front of the room, but we will have a chair at minimum for the individuals if they would like to sit during the 2-hour event. And then also there is a podium if people feel more comfortable standing when they speak and sharing their story, with the podium in front of them too. So all the rooms will have those options, and we've left it up to the patient and family advisors to decide how they want to be situated.
Mm-hmm.
I don't think we introduced ourselves, actually.
Did we not? Did that informally before the start. Okay.
Hi, everybody. Thank you for being here. We couldn't do these events without you, so we're very grateful for your time, for preparing and for doing the actual event. So thank you. My name is Michelle. I am a new instructor here at the College of Pharmacy and the college lead for pharmacy with the Office of Interprofessional Collaboration.
And I'm Laura MacDonald. I'm more seasoned educator. I've been working in interprofessional education for the last 15, 20 years, and more formally as the college lead with the establishment of the Office of Interprofessional Collaboration at the Rady Faculty of Health Sciences. And I hail from dentistry and dental hygiene.
And this is very informal orientation. So if you have questions throughout that you want us to address, just put up your hand or message in the chat, and we will happily address your questions.
Mhm.
Okay. So within your package, we will have a facilitator guide, and your facilitator guide will actually be in PowerPoint format with facilitator speaking notes. So you don't need to memorize everything. You'll have speaking notes for you, but for ease of logistics, once we send out the schedule of who's going to be facilitating in which room, we ask that one of you either comes with a laptop or a USB stick with the saved PowerPoint on there, just to help with tech logistics before mitigate it, to have either a USB or your laptop that you can plug into the screen so that you can share your screen there. So it won't be a Word document of a facilitator guide. It will actually be in PowerPoint form, and we've embedded the speaking notes within the PowerPoint that you can use.
Mhm. So the speaker notes, we brainstormed around what to say, recognizing that we'll be with the learners from 3 to 5. Time is precious. So we have provided the speaker notes, but please, if they don't speak to you, come up with your own notes, right? Like it's not, you don't have to say everything that's there. There's just a guide on the side, and sometimes in the moment you're like, you can just read the notes if you want. So we do start off with our traditional territories land acknowledgement, and the University of Manitoba, you're very welcome to use the University of Manitoba land acknowledgement, which is in the speaker notes, or you can share your own. And so at this point, I'll just share my own, that through greater depth of understanding and very purposeful journeying around understanding the history of Canada colonization, the experience of our Indigenous relations and others around this whole experience, it's really been quite awakening for me, and it saddens me greatly. And I really do commit to working in relation and collaboration with our Indigenous friends and colleagues, and make Canada a way better place.
And sorry, just a quick question. Are you guys seeing my speaker notes shared screen or the actual presentation shared screen? The actual presentation? Okay, perfect.
Okay.
It just kind of looks like it's being shared the other way, so sorry.
We are looking at our speaker notes on 2 screens. I don't know where my eye is on you.
All right, excellent.
So this slide, we ask for you to share with the students, just sort of to let them know who's in the room with them on Friday. So we have participating programs. There are 5. Respiratory therapy was going to join us, but wasn't able to. So we have dentistry, medicine, pharmacy, dental hygiene, and physiotherapy. We also have IP facilitators, and because of the wonderful response we received from you all, we are able to provide each room with at least 2 IPE facilitators. Each room will have about 4 teams. So that's a nice ratio of 1 IPE facilitator to 2 teams. And then your responsibility as facilitators is sort of to use the PowerPoint to move the session along. If you did experience technology difficulties, the PowerPoint isn't the end all be all. Put it aside. You've got the notes. You just can follow along and keep the students moving. This is very much about active engagement by our learners. It is not meant to be a lecture. So the activity does focus on the 6 competencies, focuses on 3 of the 6 competencies of our Canadian Interprofessional Health Collaborative Framework. These competencies, all of our IP experiences created through the Office of Interprofessional Collaboration, focus on 1 or more of these competencies. So these are the 5 participating programs, but nursing and occupational therapy and respiratory therapy, Masters of Physician Assistant program, midwifery, there's many different IPA activities ongoing, but through them all, the aim is that our learners enter into practice with a real good exposure and readiness to really promote interprofessional collaborative practice through these. So we are really honored and we welcome the patients and family advisors from Shared Health or the Center for Healthcare Improvement, and that we're going to let the students know that we will share, that they're here to share their stories. And here's where you may introduce the family advisors. And we say family advisors because that's what they're called, or patients. And so we're using their terms. Seems a bit of a mouthful,
Yeah.
but it's their terms.
And you'll have a mix of both more positive experiences and a couple less positive experiences too. So there will be a mix. And just keeping in mind that these are early learners. They're all in their first year of their professional programs too. So being mindful of that and helping facilitate those obstacles too as you go through the event.
So even though we're all very keen and interested in the medical, maybe health condition itself, the patient and family advisors, we met with them the other day, and they know that what they're focusing in on their story that they're sharing with us is around, did they experience a collaborative experience? Did they feel that their healthcare team providers talk to each other? Did they have a sense of that going on? Did they feel like their healthcare providers also welcome them and their viewpoints as person-centered care? So their story is going to share that. There'll be much more to their story than what they're able to provide in the 10 minutes or so that they'll begin to share their story. But they do know to try to keep us grounded on these three competencies, and less so around the medical condition itself, which would require much more than 2 hours.
Yeah. And so the patient and family advisors can be from the patient's perspective or the person's perspective who received care, or from a family member's perspective of a loved one that may have received care too.
Mm-hmm. And at this time, if you haven't already introduced yourself to the student teams, then this would be a good time to also introduce yourself. So if there's 2, there may even be 3 facilitators in the room, then just go around the room and introduce yourself, your name, and then your professional background.
And then I guess this at the beginning of the session or the activity, just addressing that we are so honored and like delighted to have these patient family advisors present with us in person. There are actually 2 out of the 18 that are tuning in virtually. But for all of you as facilitators, you will have 2 in-person patient family advisors. And then just saying, like, addressing them by their names too, frequently, and not calling them directly patient family advisors, like using their name when you are introducing them to the group will really go a long way too.
Mm-hmm. Do you think you can pull that over?
Mm-hmm. Oh wait, yeah.
Very good. Our speaker notes were sort of in the little small corner there. And then I think you can also raise that up. Perfect.
Oh, okay, there we go.
All right. So now, before we leave this slide, there's also a little note here for you to remind the students that all of them by now will have completed an online self-paced module that the Office of Interprofessional Collaboration created for all of the learners. And so they will already have been introduced to these competencies with little vignettes and stories and a little bit of a theory behind each of these competencies. So we're not starting from scratch. And so we just want you to remind the students, oh yes, you did that last fall. Go back and have a think about that. And as well, so this is the online module that should cue them in. This banner of hexagons and the framework itself is throughout the whole online module. And every time they click a page, they would see this. So it should be also a visual reminder. So you just are really emphasizing for them to draw upon that theoretical background that they already have.
And this is actually embedded in the module. This is a snippet of like an actual quote that we received from a family advisor that we put in our module too. So to kind of link it all together.
Yeah. So for example, because if you haven't done the module, which you most likely haven't, we're trying to move it into a press book for your accessibility. But the speaker note in this case for this particular slide reads like this. Today's session also builds on the self-paced online module. You likely recall this quote from a family advisor from Shared Health. These words help ground us that relationship-focused care and team communication are central to collaborative practice. And just move on to the next slide. So not a lot of time on these slides. These
Don't need to read the quote.
Nope, these are just sort of setting the scene, reminding the students where we have been and where we're going. And so where we're going are these learning objectives.
And you'll have this exact slide too. So you can pretty much just, there are facilitator notes too. So again, this one would read like, in today's IPE session, we learn with, from, and about each other alongside patients or family advisors who are with us to share their stories and help us to, 1, focus on their expressed needs and lived experiences. 2, integrate team members' viewpoints to gain shared understanding. So always being mindful that the patient and family are part of the team. And identify opportunities for bettering collaborative person-centered care. We're always striving for relationship-focused care and services. Again, tying in that CHC competency into our learning objectives. So this is a quick outline, I guess, of what the event will include. So we've kind of broken it up for ease of understanding into 2 activities. Activity 1 is, we're calling them team huddles. So each of you will have another facilitator with you, and we have, I think, 4 teams per room with roughly 8 or so students per team. So you'll have roughly 32 students in your room with another co-facilitator. So they will be situated within their room. So we're going to call them team huddles. So there'll be 4 different team huddles in your room with the 4 different teams. They are the same teams as an event that they had done in September. So instead of everybody having to reintroduce themselves again, it's just more of a reacquainting with their team members to help kind of build
team function
by having the same individuals in their team as best as possible. So there's a poem or poetic expression. We're going to use the term poem,
which we'll share with you,
yes,
and which the learners will have as a pre-read. It is 2 pages. It's not a big onerous pre-read. So they will have the poem to read, and then
they're supposed to talk about the poem and about the poem. So they should have read the poem beforehand. So we're not allowing or allocating any extra time for them reading the poem again, just more of a discussion about the poem, what it meant to them, their perspectives on it, things to take away. Essentially, they can talk about anything about the poem.
Mm-hmm. And in this way, we also are trying to simulate that a functioning team, I know certainly in teams that are highly functioning that I had the experience with, that there's always, when we meet, there's always that chance to just have a quick kind of catch up, say, maybe you talk about something you just read, an article very quickly, and there's sort of a settling into the meeting. So this is what this intent is supposed to be. So if they don't talk about the poem, that's not the end of the world. But the poem is there as a catalyst for them to begin to reacquaint with each other. Again, they have met each other. Maybe 1 or 2 might be new to the team, depending on fluctuations in classrooms, but they have met each other.
And then the second activity is essentially where we start engaging with the patient and family advisor. So this activity 2 will actually be repeated because you'll have 2 patient and family advisors in your room. So activity 2 will be done once with the first patient family advisor and then repeated again for the second patient family advisor. So this activity kind of has multiple parts to it, but essentially first the learners will listen to the patient family advisor give their story. We have allocated 10 minutes for this. So some of the stories will be a little bit shorter, 5 minutes, and that's okay. We're wanting them to naturally deliver their story the way that they experienced it and the way that they want to deliver it. And then we've respectfully requested that, if possible, without taking the intent of their story away, keep it within 10 minutes. So trying our best to still deliver their experience and their story, but keeping it within 10 minutes so that we're not missing out on that interactive component and that engagement with the patient family advisor. So they'll share their story for 10 minutes or less. That's okay. We'll just have more time for questions after. And then once the patient family advisor says their story, we will get the learners to go back into their teams. So another team huddle where they will brainstorm questions to ask the patient family advisor with justification on why they're asking these specific questions. And we have a team template for note taking for the teams that we will show you too, that will help guide the students in their brainstorming.
So the role responsibility as facilitators then is to circulate or between the two teams that maybe you work with, just to be present, helping them with that brainstorming, as well to keep the students on time, right? So you will have a printed agenda with timelines that are I'm going to say strongly suggested to keep you moving. But of course, there's wiggle room, and you will, if need be, have to work on the fly to find time. But one thing for sure is we cannot go overtime. That never goes over well with students.
Yeah.
Or for anybody, all of us, we respect each other.
And encouraging to link back the question specifically to the story that they just heard, not generic, less personable questions. We want them to really kind of dive into, did you actually hear that person just give their story and their lived experience? And you're asking a very intentional, thoughtful question to them. And then open-ended questions, of course, not closed-ended questions.
Mm-hmm.
So then after they have a chance to do that, that'll also give some time for the patient family advisor to kind of, maybe giving their story was very emotional for them. It kind of maybe brought up some, obviously their lived experience. So that will give them about 10 minutes to kind of just decompress a little bit after delivering their story.
And we share that because when we have 18, by the way, we have 18 patient family advisors joining us. So we have 9 rooms, 2 will be in each room. And we did meet with them the other day, as I mentioned, and they did share that, when I tell my story, and it sort of didn't matter when they told their story or to whom, they often got emotional. And so that they would tear up as they were telling their story. I can relate to that. And so they said that they will be very mindful of that and let the students know before they tell the story that this may happen, that I will tell my story, I may tear up, and not to be alarmed by that. I'm okay, I am here, and I want to share my story. Similarly, if the students are emotionally triggered by the story, that there's a speaker note here that the student certainly can leave the room at any time and return when they're able to. So then we'll get together, and we've got this mapped out, so we'll probably repeat this again just to make sure you understand the flow of it. But then they'll engage with the teams will each engage with the patient family. Again, your role responsibility will be to serve as sort of the moderator. That we have 20 minutes set aside for this. There are 4 teams in your room, so almost approximately 5 minutes per team, and you can decide how you can manage it. Whether you do 1 round of questions and there's time remaining in another round, or maybe some question is so substantive and there's more time spent on it. So then that the second patient, when they share their story, that maybe the team that asked that question that was so substantive doesn't have to ask another question. They will create more questions, but may not be called upon. So you just sort of navigate that in the room as facilitators, to make sure that each team does at least get to ask at least 1 question in between the 2 stories.
And then we want this to be more of like an open dialogue and more of a conversation too. So depending on how long the response was from the patient family advisor, if it was, maybe only a minute or 2 minutes, then maybe if the team has a follow-up question to their response, they are able to ask it at that point too, keeping in mind roughly 5 minutes per team, if you think of it that way too.
And we're not here, none of us as IPE facilitators, to be lecturers in the room, but we certainly are here to offer some insights or maybe a prompt. So if that feels appropriate, and that will be very much dependent on your room that you're in, if you feel like you can add or do the
Yeah.
follow-up question, that's absolutely fine. Right? So we're in it, we're all in this together. So.
Okay, and this is just highlighting that we're gonna do this twice with the second patient family advisor. Okay, so here's this agenda that you've all been waiting for. Probably should have showed it first, but essentially this is a timeline, strongly suggest a timeline of the day. So if you are not able to come 15 minutes before to set the room up, if you are able to just let us know beforehand so that we can make sure that we can set up your room. But we're hoping that between the two facilitators in each room, one of them will probably be able to come
But we
15
can
minutes
do
in
it
advance,
too.
but we can also do it. And then we'll have the welcome and introductions and the land acknowledgement, the slides that we had just gone over. The activity 1, which is kind of an icebreaker, we're talking about them reacquainting and then having discussion about the poem. And then we get into our activities 2. We're calling them activity 2A for the first patient family advisor and 2B for the second patient family advisor. In between the two engagements with the family advisors, we will have a break, a 10-minute break in between. But it'll essentially be the same format repeated twice, and then we will have a wrap-up debrief and attendance with their and a survey on the event, and then an optional facilitators debrief in Theater E the last 30 minutes. Again, stressing that this is optional, but we open your feedback, especially when it's very fresh in everyone's mind, to even talk about it, the stories or the event itself, or any feedback that you have.
So if you could go back to the other slide, we will not have the agenda, so the detailed agenda on the PowerPoint for you to share with the students. It tends to make people try to not have flexibility. So this is why this activity outline is what you'll share with the student. There are speaker notes to speak to it directly, and then you would move on directly into the next slide.
So we would skip this. This would just be for you.
Yeah, it's you. We'll have a hard copy for you for that. And then we'll begin this activity. So the speaker notes read like this for this activity. They've already been primed that they're going to be doing this. So in your first team huddle, take 10 minutes to reacquaint as a team. The activity simulates what teams might do to promote teaming and belongingness. They get to know each other's perspectives, which facilitates team communication and team function. So already in that very brief narrative, you're hearing the learning objectives. We're emphasizing them, right? So remember Metarisky in her poem, your assigned reading, create in the poem, and you'll have the poem as well. She begins with, I always wonder, do you as a healthcare providers see me individually and as a team? So already the poem launches us right nicely. So use the poem and ask yourself in your team huddle, what came to mind when you were reading it? Really be sure to hear everyone's viewpoint. And do you have a sense of a shared understanding of the intent of the poem? And then they'll have 10 minutes to do this. Circulate around them, listen in, offer some insights. And then here is our visual representation, Michelle's and my graphic artwork of what it looks like in the room when we move to activity number 2. So again, the speaker notes are here for you. Please use them, or if you have another way of expressing it, please do so. So you'll share with the students that first they'll hear the team story, so that look around the oval and the patient family advisor is in the middle and all the teams. We're not actually having them move from where they're sitting in the theater. It's but we're all focusing on the patient family advisor and their story.
It's just really to show that the patient family advisor is a part of the team. So they will still be situated within their teams from the beginning. Like they're not going to move and circle around the patient family advisor for like storytelling. It's just kind of to show that they are part of the team.
And that this is done. All teams are listening to the story at the same time.
Yeah.
And the second thing that'll happen is the team huddles for them to brainstorm around the questions with rationales. Like, why are you asking this question? What is the purpose of the question? Or what are you assuming? And when they present the question to the family advisor story, which is the third thing they do, the 20 minutes there, when they ask the question, they should share their assumptions, right? Because we're having a dialogue with our patient family advisors. So our role as facilitators is just simply to moderate that. And then, so that's the first, the second thing, and then the third thing. Is there any questions? Does that visual help?
Hi, I had a question around the poem.
Yeah.
On the activity timeline, it said read the poem. So are we
Thank
actually
you.
reading the
Did
poem?
we say that? Oh, I thought we had that
Oh,
removed.
okay, sorry,
I'll
thank you for
take a
catching
pen.
that.
Okay,
that's
I
good
just
because-
wanted to double check if we were
Nope,
reading
good
the
double
poem,
check.
if you had wanted the
Discuss.
facilitator to read the poem.
Yep, no, good. This hasn't been sent out anywhere yet, so that's great. Discuss the poem.
Okay, so we're not reading the poem.
No,
No, just discussing it. Okay.
yeah,
Thank you.
no, they've had it as a pre-read. Yeah. Thank you. And
That was
Catherine,
learning.
it
Okay.
would be great if you keep an eye on the chat for us. Thank you.
Thank you. Okay. I think that's
I think that's it.
probably
Yeah.
good here.
And we'll just we'll give them a reminder that the patient is sharing the story. It's all publicly, sharing it in this space, but we still want to uphold privacy and confidentiality. That when they move out into the world after 5 o'clock, that they maybe think about it in themes rather than specific story and details, but more thematically. Like we expect them when we introduce any patient with them.
Okay, and then we will take a movement break and they will have 10 minutes for this. And in this break, both patient family advisors will be there present through the whole team, so they will hear each other's stories. So it's not like the first family advisor needs to be escorted out or to leave. They're staying for the whole
They
that
feel
whole
solidarity
activity.
in
Yeah.
that.
Yeah.
Mhm.
Okay, and then this is just essentially a repeat of the other slide we just went over, but it's with the second story.
And in the speaker notes, and you're obviously not going to repeat what you just said earlier, but in the speaker notes here, we just remind that they'll share the story and then in your team's brainstorm questions, but to be sure your brainstorming is of new questions drawing from the second patient's story. And to select their top question and be prepared to ask other questions because somebody might ask the question beforehand. So both of these periods take between, what did we say, 40 to 45 minutes. And we've allocated that time on the agenda. So
we will go over the the student question template with you, but essentially they're brainstorming 3 really rich, good questions. So we're getting them to do 3. One for if there is more time, each team potentially may get to ask 2 questions. And the other reason for drafting multiple questions is if another team has already asked that question, they'll move on to their next question. And we're hoping that they rank them in order of priority that they would like to ask.
Mhm. All right, so that would be the 2 activities, the initial huddle, getting reacquainted, getting a sense of team communication and function, the activities with the 2 patient family advisors, a break in between, and then we will do a wrap up. So this slide is intended to bring all the teams back together to sort of just have a really large group debrief. It's not meant to be a big and long debrief. We're thinking no more than 10 minutes between this and doing the evaluation, giving them time for the evaluation, which was also brief in the attendance. So the speaker notes on this read, team-based collaborative care occurs when multiple healthcare workers from different professional backgrounds provide comprehensive health services by working with patients, their families, carers, and communities to deliver the highest quality of care across settings. Based on today's session, what are some final thoughts or takeaways on team-based collaborative care? Sometimes when we ask this question at the end of any session, there's silence. So you might, as a facilitator, say, I really liked that question, and just sort of pull something up, and this will be on the fly sometimes, but give silence, usually count to 10 seconds is kind of the golden rule. And if nothing comes forth, that's okay. We are moving to wrap up, and you likely have some final thoughts as well. keeping in mind that we're trying to emphasize that person-centered care is the aim, that we're looking for, being respectful of different viewpoints, and that we're trying to better collaborative care, which are really the 3 learning objectives for the session. And then
we will just end off with the learning objectives, just to tie everything in back to our learning objectives. It's not meant for you to read these again, but just
time to thank the advisors.
Yeah.
And there's a script to prompt you for that.
And then the last slide that will have the attendance and the session evaluation. However, there will be the hard copies that we talked about at the beginning that will be placed at each team. So they'll probably have already done the attendance. They'll probably do it right when they sit down, probably. And then the evaluation, if there is still a few minutes before 5 p.m., encourage them to stay to complete the evaluation before they leave. It'll only take a few minutes.
Less.
Yeah.
And attendance, there's a script note there for you that attendance is shared with all the programs. So we give each program that's participating in the attendance list. So I think it's really, and we always have 1 or 2 students that were there that didn't do the QR code. They missed it for whatever reason. And then we do follow up with them and say, you weren't in attendance. And then they say, yes, we were. And then we just ask for some proof of, and so sometimes that's a meeting with them where we have a dialogue where will tell us, what did you get out of it? So we do follow up on it. Best is that they use the QR code.
Yeah.
So let's go back to, sure. Yeah, good idea. Any questions again while we're pulling the document up? Very interactive. You're not doing a lot of talking. Again, if you had technology difficulties and the PowerPoint wasn't working, you don't need it. You just will move them through the session.
Okay, Dr. Mahani has a question.
Thank you.
I was just going to ask, because all the families and the patients are real, and those are real life stories, because I've been around for quite a bit at the Health Sciences Center. If these encounters were at the Health Sciences Center, I'm going to introduce myself as with my real name, right? Like, I'm not going to worry about anybody knowing me or anything like that.
Oh, yeah, no,
Okay.
I mean, so you're saying like, if I'll just see if I understood what you said, like, if I'm sharing my own personal, if I gave a little insight to a personal story that I am expecting that the students aren't going to go out and talk that, Laura said this, absolutely. We uphold professionalism.
Or are you asking if we actually introduce them as their real name?
No, I'm not sure if they're instructed to use their own names or not, but for us.
They are.
Okay, so.
Yeah, and we have, and Moni's been involved in all of this too, but we have worked a lot with Shared Health, CIHA, and they have very much affirmed that is exactly it.
Okay.
Yeah, but they should not, I'm sorry, I misunderstood your question then. They may say my family member or my mother or something like that, but not, they will say, I'm Laura MacDonald. Which of course opens it up for all sorts of things. And we have vetted that out. We've been searched in the literature around that, so.
And in terms of giving both first and last name, I feel like we could, as a facilitator, when you meet your patient family advisors, you can ask them how they would like to be addressed.
Mm-hmm.
Yeah.
You know what, can I add a comment to that?
Yeah.
Just to reassure you as well that there is a coordinator of the program with the patient advisors, the family advisors, and they meet afterwards to debrief to ensure that the people who are sharing their stories have as much psychological safety as possible. So they are individually supported. I think it's probably a good reminder for all of us as regulated healthcare, most of us regulated healthcare providers, that in the wrap up, or as we're introducing the speaker, to remind the learners that these are real stories and we need to keep confidentiality and privacy in mind. And so you can share the learning, but the story stays in the room, especially since real names are being used. So that's also a good reminder for us to make sure that we tell the students that do not go and tell this story at your dinner table using people's names.
That's great.
Yeah. Mm-hmm. That's where you could use a theme or a thematic learning around that. Do you want to?
Can everybody see the screen on the document? Yeah. So this is the document that the students will have. We will also have probably a printed copy for the facilitators to reference too, but essentially, we give a little blurb about, in preparation for the engagement with the patient family advisors. As a team, you need to think about and articulate questions based on their story. So assign one team member to document the questions and the rationale for the questions. Essentially, we're just reminding them that the importance of documentation as well.
As a team, if you have a team
yeah.
meeting, you have some notes. You're still seeing, we're still gonna be working on this a little
Yeah.
bit this afternoon, so we'll tidy up the visual presentation of it and any grammar. But yeah, it's just that why they are taking notes is just to simulate that when you have a meeting, it's a good idea to take notes. Artificial intelligence is helpful in this as well, but this time we're still, so this will be a hard copy on their table.
And they're to leave it there.
And they're to
right?
leave it there. So if they want to take evidence of it, they can take a picture of it. And some programs have portfolios as part of their students' programs. And so some students will really value this as a piece of evidence around them developing as interprofessional collaborative practitioners. They leave this behind. We ask that you collect them, put them back in the envelope package, and we will gather them all. And this way we also get insight into what they were asking, questions that they were asking.
And so we just remind them of the learning objectives to keep them, I guess, grounded in their questions, to tying them back to our learning objectives. So we have it separated out here. I'll just zoom out if you can still see it. We have the questions, so select your top question, but be prepared to ask a different one. So this is for the first family advisor. We think 3 is sufficient enough given our time constraints, and we don't want them to just list a bunch of questions that aren't specific to that story that they heard. So being very intentional with their questions is something to stress, I guess, before they brainstorm. And then we want them to justify their rationale in regards to the relationship focused care or team communication or team function. So really getting that rich question rather than just a generic question for the patient and family advisor. And then there's just space there for the second family advisor. So after the break, when we start with the second one. Any questions about the template? At the top of the template, we do have them to put their team number that they are in, and then the names of the students and their respective programs. And then I will share the other document that we had talked about. So
we are working in collaboration with their 2 leads from the Center for Healthcare Improvement, Marianne, and with Susie McLeod from Shared Health. And they are in constant liaison with their respective patient family advisors. And the patient and family advisors asked us, what kinds of questions would the students ask? And, respectfully, the stories are their stories. So to the best of our ability, we have come up with some predicted questions that maybe the students might come up with. And when we were with them the other day, they wondered, should they prepare their story around these questions? And we said, please don't. We want your story to be authentic and real for you. Share it as you see. And with these may be some questions that come up. So despite the fact that they are using 10 minutes to share a story, there will be 20 minutes of conversation, discussion, engagement that will enrich the story. So more of the story is going to come out through the questions.
Yeah.
So
and another thing, they also, so not to change your story to incorporate these questions. And the other thing is we don't want them to script the responses to these answers either. Again, because these are just potential questions that they might ask. And we don't want it to be scripted. We want it to be more, like Laura said, more of an authentic, genuine conversation rather than having it scripted. But to ease maybe a little bit of their anticipation or unsureness of what the students may ask, we provided a list of potential.
So have a read through these, and if you have others that you think they might ask.
And those of you that were also facilitators last year, we did do this virtually. And the change from last year is now it's in person too.
So the Some of them are some of the patient advisors did this last year. Some of the patient advisors work with other programs. I know they mentioned Red River, that they go to Red River
Yeah,
and they
nursing,
do
nursing,
something similar, I'm imagining there. Some of them are seasoned, some of them are new to it. So this is the situation for us. So we will provide you with these questions too. So if there's a lull and nobody's asking a question, certainly go ahead and you can ask one of these questions or come up with your own.
We hope, though, that with the students having 10 minutes to think of at least one question, that they should be able to ask a question.
Mhm.
And that you shouldn't have to ask one of these questions, but again, yeah, they're there. Or if extra time is permitted, select your favorite. Or
Mhm.
any questions about these? Any other things that you think the students may ask that isn't embedded in this?
Are you comfortable? Mhm. We're going to send an email again, either tomorrow or probably Monday. It will have the details of what will be in the package. We will electronically attach everything as well. But just so you don't have to print things out, if there maybe you don't have a printer readily available, that all of it will be a hard copy in that package. So that's all going to be in the room for you. I had another thought I should have.
And then the other things, if you'll have another facilitator with you.
Yes.
Not both of you don't have to speak. If one is more comfortable speaking at the front, that's fine. Or you could on the fly decide, like, alternate slides, or however you want to divvy up the speaking can be done however you see
Mhm.
fit.
Mhm. Some of you are more seasoned as well, and so we have connected what new facilitators with you. So they you'll have each other's emails, and so you can connect beforehand and just get to know each other a little bit, and maybe somebody might say, I don't want to do any speaking at the front. And if you're comfortable, then that's fine. It's not supposed to be a show on the front of the room. Not by the UN, at least. We want to get out of the way and let the students engage.
Any questions, or I don't know if we want to stop recording, or should we stop recording?
We could stop recording.